students. Happy afternoon and a warm welcome to one and all. Dr. Vaishnavi Joshi, medical oncologist and hemato-oncologist at Aster Bangalore, has a very special interest in the treatment of lung cancer, breast cancer, lymphoma, and multiple myeloma. She strongly believes in clean medical practice backed with knowledge, empathy, and ethics. Warm welcome from Taproot family. Dear ma'am, I request you to take over the session. Almost 6,000 students from various campuses would be hearing you today. Over to you, Dr. Vaishnavi Joshi.
Thank you so much for this kind introduction. It's a pleasure talking to all the students. It would have been great if it was a physical meeting because it would have been nice interactive session, but we'll try to make the most of it. So I believe students are from 11th and 12th standard and some from degree colleges. Am I right?
Yes, ma'am.
Okay. Okay. So thanks for inviting me. And then it's always a privilege and great pleasure to talk to the younger generation. And, they have a huge responsibility to carry. And it's always nice to talk to young minds who are inquisitive to learn and they can absorb new ideas. So because the concept of cancer, we also understood much later in our medical practice because in our MBBS and MD to go with the training in cardiology, neurology, nephrology and other specialties we used to concentrate more on that than medical oncology. And over the last 10 to 20 years, the kind of growth which has happened in medical oncology and in cancer research has made us more encouraged to take up this field. And I feel thankful now for this decision, to be an oncologist. I'm sharing this because there must be a lot of students who would want to become doctors in your field, in your colleges, sorry. So coming back to the topic, today is World Cancer Awareness Day, the National Cancer Awareness Day, 7th November. So why do we observe these days? We do Mother's Day, we do Father's Day, and then we do Cancer Day, and then we forget about it. But then it's very important that on these days, Cancer Day, we at least learn a thing or two, because knowledge is power, and nowadays knowledge is time, and then knowledge is future. So for all the students, I hope they can all hear me clearly. So I think the students in their families also must be hearing here and there that relative got diagnosed with cancer, or this relative got diagnosed with cancer. And we have come a far distance from saying there is a diagnosis of cancer, there is nothing much to do. It's almost like a death sentence a few years ago. But now we have treatments, effective treatments for most cancers, definitely if they are diagnosed early. So it's very important for the young minds to know what is scientifically true than hearsay or rumors from the family members or in the society. So it's very important for the young minds. I really appreciate this initiative from Taproot colleges to educate young minds about cancer, because they are the ones who are going to be, if not doctors, they are going to be biomedical engineers, they are going to be scientists, they are going to contribute to molecular research, they are going to contribute to cancer research. So because there is so much to be done in this field. So why is cancer important these days? So the recent statistics, my dear students, say that 1 in 10 Indians are getting diagnosed with cancer. You realize how big this problem is. It's a huge public health problem. And 1 in 15 may also die of cancer in India, especially. Why does this happen? Because even after so much of advancement in India, patients are reaching us only in the advanced stages. That is, when the cancer is so advanced, it is spread everywhere, and cure is not possible in those stages. So that is the reason the deaths due to cancer is increasing. And why is cancer increasing? There are multifactorial reasons to this. We don't know exactly why it is increasing. One is because we are living longer. We are seeing more people living longer. And as you age, we accumulate something called as gene mutations. And if you have a lot of science students here, they will definitely know we acquire gene mutations because there are small errors in the gene replication, and then finally the reproduction. There is small errors which come up in the gene replication. So as these errors accumulate, may lead to cancer. So as we age itself is a risk factor for cancer. So as age itself is the risk factor, as we are aging, the average age lifespan was earlier. Initially, to start with was 45, and then at 55, now it's 60, 65. So we have more people living longer. So that is the problem, right? So we have more cancers also. We see a lot of cancers in 65 to 70 and 70 and above age group. And also because of a lot of lifestyle changes, we are seeing a lot of cancers. So what is cancer? And if I was there, I would have asked a few questions, but then I will answer it myself. So cancer is a cell. Cancer cell has three properties. One is, it is for any cell to grow, what should be there? There should be a purpose. If a child is growing, a few cells are destined to become a liver. Few cells are destined to become brain. Few cells are destined to become an eye, or as few cells are destined to become skin. So there is a purpose to each cell. So what happens in cancer is this cancer cell loses its purpose. It doesn't know what to do. So this is purposeless, because an extra growth or a cancer growth is purposeless. This is the same which, I think your parents and teachers keep telling you, that have a purpose in life. This is what they keep harping about. Otherwise, it becomes like a purposeless cancer cell. So purpose is very important for the cell as well as an individual. So purposeless is the first characteristic of a cancer cell. Next, it is autonomous. So for example, what is autonomous? See, for example, if you have a college, you have your principal, and then you have teachers, you have vice principal. There is a hierarchy, and also there is a there is a kind of system which is in place to take care of the whole organization. So then there is autonomy. Each student acts on his own. So what happens? It becomes anarchy. So there is no system at all. So cancer cell also has its own autonomy. It has no control from the higher centers. So it grows on its own. So it is autonomous, it is purposeless, and it is, the third one is uncontrolled. So for a hand to grow, you have, for destined to become a finger, it has to grow to a certain centimeters. So if it grows beyond that, it is uncontrolled. So there are certain check mechanisms in our body which ensure that a body part grows to the certain centimeters or a kind of measurement. But in cancer cell, this is lost. So what is a cancer cell? It is autonomous, it is purposeless, and uncontrolled. So that is how cancer proliferates. So there are multiple cancer mechanisms, carcinogenesis, what we call. I will not get into that and bore you. So just have to remember that these three important functions are lost in a cancer cell. And we talk so much about cancer. Why don't everybody get cancer, and why only few get cancer? So what are the risk factors for cancer? So there are certain unmodifiable risk factors, and which cannot be modified by us. I mean, we're just born with it. And certain modifiable risk factors. So certain unmodifiable risk factors are, what we call as familial cancer genes. So everyone, in my OPD, I'm sitting in my OPD now, and then every day, every patient comes and asks me after diagnosis of cancer. Doctor, why did I get it? I don't have any family history. There is nobody in my family who has cancer. So then why did I get it? So, to actually, the truth is only 10% of all the cancers diagnosed have a significant family history. So, rest all cancers are just multifactorial. So, there could be some errors in our genes which lead to cancer, and then the multifactorial environmental exposures can trigger these errors and lead to cancer. So, only 10%. Have you heard of Angelina Jolie? You must have. I think all of you, all the guys, they became very sharp. Okay, so she's also quite old now. So Angelina Jolie has a family history of breast cancer. So she underwent a bilateral mastectomy. So it was very popular then, few years ago. So everyone wanted to have breast cancer surgery done, for a breast surgery done after that history. So it doesn't work that way. There are certain criteria for familiar cancer genes, and it works only in 10% of the cancer patients who have had these genes, and they are predisposed to have these cancers. Rest all are, we don't know. It's very easy as well as very difficult to say that I don't know the answer. Okay, so that is one unmodifiable risk factor, your family history and certain errors in your genes. And also there are certain hormonal factors. It could be in breast cancer, the early menarche, early onset of menses, or the menses going on for many years, late menopause. These are certain risk factors, unmodifiable, which could lead to cancer. Coming to modifiable risk factors, what are those? We should concentrate on what are modifiable risk factors. For example, smoking. Smoking for many years was, smoking is one of those risk factors which we cannot deny at all. For certain other cancers, for other risk factors, we can say this could lead to cancer, this might lead to cancer, this may lead to cancer. Smoking has a definite link to cancer. Definitely. So the smoker's risk for cancer and a non-smoker's risk of cancer never becomes equal. Okay, not all smokers get cancer. That is true. You may ask me a question. So many are smoking. Why are they not getting cancer? But their risk is something different. That is what you are predisposed to. So the risk factor for a smoker never reaches that of a non-smoker. So smokers can get mostly oral cavity cancers, or the lung cancers, larynx cancers, or abdominal stomach cancers, and bladder cancers, certain blood cancers. These are more than 12 or 30 number of cancers are caused by smoking, and there is a definite risk with smoking and cancer. Alcohol also is a risk factor for cancer. The most important now is, which everyone is talking about, the new kid on the block, is obesity or sedentary lifestyle. So obesity, does it lead to cancer? Yes, it can lead to cancer. Number of cancers like breast cancer, colon cancer, stomach, lot of cancers are being linked to obesity. Not only do they cause heart diseases, diabetes, and other lifestyle cancers, even it can lead to cancer, obesity. So what we call sitting is the new tobacco. So you have to be very, very active. I mean, this is not something I talk to 16, 17 or 18-year-olds. You're all very active, I'm sure. But yes, as age advances, as we grow older, we become sedentary. So, and then sitting more, okay, has been compared to tobacco these days. It is that kind of a risk factor. So sedentary lifestyle and obesity is becoming a very big risk factor for cancer. So these are the few, and there are others: environmental exposures, environmental pollutants, and then pesticides. They are all implicated in cancer. So does cell phone usage cause cancer? Many people, I think your parents must be telling you this. So to say scientifically we don't have definite evidence doesn't mean you have to stick to your phones all the time. But yes, any type of radiation, anything which is done in moderation should be encouraged. Anything which is excessive, even a cell phone usage, we don't know. In coming years, we will have definite evidence to link the radiation to exposure to cancer, and also the telephonic radiation to cancer. We don't have definite evidence as of now, but I would say safe to say keep everything in moderation. So these are some of the risk factors of our cancer. And what do we do? We are only talking about risk factors, and I will not get into the treatment. So, what is screening? You know, it's very important as youngsters, children know about screening, because you are the, future. You are our future, and you are your parents' future, and your family is looking up to you because you are getting that education. So, you also owe something to them, that is, you can take your mother or your aunt to get a mammogram done. So what is a mammogram? See, mammogram is just an X-ray, okay? And it was one of the most important screening methods, okay, to detect any cancer, for example. So for any cancer, screening is very important as we detect cancer in the early stages. So to detect breast cancer in early stage, the screening is called mammogram. So we have screening techniques only for 2 or 3 cancers. One is a breast cancer, which is the number one killer in Bangalore and in India. And cervical cancer, it is pap smear. So it suffices you to know that these are the 2 screening techniques, especially in women, to find out if we have early diagnosis of a cancer. So what as children you should do today is to go back and ask your mothers and aunts and grandmothers, or that did they get a mammogram done. Okay, so mammogram is just a simple X-ray. There is no major radiation or anything, but it has to be done after the age of 40 years to find out if there is any early sign of breast cancer. So these are certain, and there are others like colonoscopy, stool testing, and a lot of other screening techniques. But you should remember that cancer screening, most important is a mammogram, pap smear, and at 50 years can undergo a stool test or a colonoscopy to detect colon cancer. So you are going to go back and ask your parents that did they do any cancer screening. Okay, as students, this is your responsibility to take care of your parents, right? Okay, so that is about screening to detect cancers early, because early detection of cancer ensures that cure is possible. So we are curing a lot of cancers if they are detected early. Coming to what are the advancements in cancer and why should you know about it? Okay, so what have we been doing as oncologists? I'll just tell you 2-3 points. So there has been a lot of research in the last few years which has happened not only in cancer treatment, also in cancer diagnostics. What is a diagnostic? It is a test to detect not only cancer, also the genes involved, also the molecular pathway involved. This is very, very important because we can find out certain targets, and then finding a target will see that will ensure that there is a targeted therapy to it. So there is a lot of research which has happened. Does anyone know about the Human Cancer Genome Project? The Cancer Genome Project, which showed all the Human Genome Project showed all the genes in the human DNA. So just opened the whole Pandora box like this. It just showed what all genes is there in the human DNA. So after that, there has been so much research that we know a number of, multiple number of cancer genes, which has helped us to develop more therapies. So now what we do is no 2 cancers are treated the same. Okay. What do I mean by that? I mean, each cancer, whether it is in lung cancer, for example, we first find out what kind of cancer it is, whether it's a carcinoma, lymphoma, and then if it's a carcinoma, what kind of carcinoma it is. And then we detect what genes are there on this cancer. And based on this, we do personalized treatment to each of these genes subsets. So it has become so, precision based. It has become so accurate. So why I am telling you all this is, so that at least some of you get inspired to study cancer and cancer research. So it's not only the cancer treatments which have evolved, also the cancer molecular genetics or the diagnostics which have evolved in the last 10 to 20 years. And not only as the cancer treatments have improved, you must have heard 20 years, 10, 20 years ago, chemotherapy used to be very, very toxic. Patients would vomit continuously. They would have lot of fevers. They would get admitted frequently. We are not seeing all these days. There's so much of toxicity these days because not only has cancer treatment improved, lot of supportive medications which we give to prevent vomiting, to prevent side effects, that has also improved. So patients are tolerating treatment well. So not only in the early stages, cancer is getting cured, in the late stages, we are able to prolong survival to many, many years. So this has happened. This is the current reality. So to conclude, so with all these advancements, what can you as a student do for cancer awareness? Okay. So as a student, as I told you, it opens a lot of, fields to your lot of study opportunities or fields when you study further in science. You have so many options these days, and in molecular oncology, molecular genetics, and then you can study, you can become a doctor, oncologist, radiation, surgical, medical. These are all the fields you can explore, and also you can think about cancer research seriously, because there's so much happening these days. Oncology is no longer a very dull and depressing field. It's a very bright and promising field. And also, as a family member, what do you do as for cancer awareness? Cancer awareness, it's, as I told you, knowledge, is very important. It just doesn't come from WhatsApp and Facebook and Instagram. Knowledge comes from your textbooks. Google also. There's so much knowledge available about cancer in Google also. Don't Google symptoms of your relatives. Please look into what is the science behind these cancers. And also, if there is a patient around you, please guide them to the correct person, because the right detection, early detection can lead to cure and also a longer survival. So it's very important. As students, you could be some important influencer. Influencer doesn't always mean it's on Instagram. Influencer means that with the knowledge you've acquired, how you help other people around you. So I'm sure all of you will be able to do this, and then guide people around you scientifically, and also help them to improve their quality of life. So if there are any questions, I can take.
Students who are seated inside the classrooms, if you have any questions, you can come forward and maybe pose a question. Of course, I have got a couple of questions, ma'am, from different branches. So on behalf of the students across branches, I have got some questions. So one of the student wants to ask, Doctor, we are teenagers. So we wanted to know whether there are any vaccinations for cancer. Can we prevent some sort of cancers? So that was one of the questions asked from one of the students from Bida.
Yeah, that's a very, very important question. I'm happy somebody asked that, because there's so much to cover. Yes, there is cervical cancer vaccine to prevent cervical cancer. It's called HPV, human papilloma virus vaccine. It should ideally be given after the age of 11 up to 25 years of age. And if you have not received it at this young, it's as teenagers, you can always take it. It is, if you have not received it before 15 years, it's a 3 injection schedule. If it is before 15 years, it's a 2 injection schedule. So you can always meet a pediatrician or a gynecologist or come to us as oncologists and take these injections. What these vaccinations do is reduce the what we call as human papilloma virus growth in the cervix and prevent further cancer development. So this also can reduce anal cancer risk in boys too. So we are encouraging, it's not come as a guideline as for boys, but for girls between 11 to 25 years of age, it's a good vaccination to prevent cervical cancer. And the other one is HBV, that is hepatitis B vaccination. Of course, it is come in the Indian Academy of Pediatrics IAP schedule. I think all the kids here must have received it during the, if you have not, please go ahead. Hepatitis B vaccination is compulsory now, and that can prevent later cirrhosis and also hepatocellular or the liver cancer. So these two are the vaccinations. One is HPV or the cervical cancer vaccine. The second is the hepatitis B vaccination. These are the very two important vaccines which are cancer prevention.
Thank you, ma'am. There's a student who wants to ask a question.
Yeah, please.
That the food we eat, especially the maida, it causes cancer. Is it true? Up to how extent?
Sorry,
please repeat, sir.
The food we eat nowadays, especially maida, I've heard that it causes cancer. How true is it?
How true is it? Right. Okay, so refined flour and refined carbohydrates have been implicated in cancer, and excessive use of refined carbohydrates. I am sure nobody can quantify what is the amount of maida or what is the amount of refined carbohydrates you can take, but naturally available carbohydrates are much better than what are refined, especially found in the sweets or all the condiments and the confectionaries. But as kids, it's heartbreaking for me to say stop eating chocolates and stop eating cakes and all the refined carbohydrates for you. But yes, please reduce and take everything in moderation. But refined carbohydrates, more red meat consumption, and packed and packaged foods, and also processed meat, processed food, these are all implicated in cancer development. Yes. How much, how long, how true, that is, cannot be quantified. So that is why it is better to reduce this in our regular diet. Yeah.
Ma'am, I have a question.
Yes.
More than active smokers, passive smokers are in danger. How is it possible?
Sorry, smokers?
More than active smokers, passive smokers are in danger.
It's not more than active. It is definitely as active smokers, definitely the inhalation is into the lower bronchioles and alveoli, and passive smokers are as at risk as active smokers, but it's not more than active smokers. So both active and passive smoking, both should be avoided. Yeah. You inhale when you're smoking, it goes to the lungs. So it is definitely the exposure of the carcinogens is more to the one who's actively smoking.
Thank you.
We'll take one more question.
Yes, ma'am. So there is a question from one of the college students from MIPU.
Yeah.
She's asking whether more usage of sunscreen, will it cause a form of skin cancer?
Sunscreen.
Yeah.
Usage of sunscreen causes cancer. What?
Yeah, that's what is it? See, a lot of what she has said is whether more usage of sunscreen, will that damage our skin, or it is the vice versa?
It's actually the vice versa. Sunscreen is a good good method to reduce our skin exposure to the harmful UV rays. The skin cancers, although are not much seen in our country, it's not a huge menace in our country. Definitely in the West, skin cancers are seen in more. The incidence is much more, and sunscreens have reduced. They definitely reduce the exposure to these carcinogenic UV rays and reduce the incidence of skin cancer. Yes, sunscreens are recommended, definitely. They don't as such cause any cancer. Not known to any study or anything cause sunscreens causing cancer. It's the other way around. Yeah.
Students who are seated, maybe ma'am, last one more question. Anybody who could just come forward, because ma'am, we have all campuses, all students seated at one place. So any student? Okay. I think ma'am, they have no questions as such, or I think they thoroughly enjoyed your session. They have been taking all the inputs from you. So I'll just...
Thank you so much. Thank you.
Just a second, ma'am.
Yeah.
Just a second. Yeah. So I have a student to express her thanks to you. She'll be just addressing you.
On behalf of the student community of Taproot Group of Colleges, I would humbly thank the guest speaker for the day, Dr. Vaishnavi Joshi, Consultant Medical Oncology and Haemato-oncology Aster Hospital, Bangalore. Thank you, ma'am, for taking us on a journey with your expert session on cancer awareness. It has helped us understand the main facets of this complex disease that touches the life of millions across the world. We are indeed grateful that in spite of your highly busy schedule, you have accepted our invitation. I thank the management principal and faculty members for arranging such a session. I'm sure this session will indeed be a beacon of hope in that as this knowledge would be passed to 6,000 families.
Thank you so much. Thank you all.
Thank you, ma'am. Thank you for your, in fact, you were so simple in your language. You were, you have really made the session interactive in spite of the fact that we were virtual. Very simple way of making all of us understand. Thank you, ma'am.
Thank you so much. Thank you for this patient hearing, guys. What are the images I see? All were sitting very patiently. I don't know what was the reason for it, but then I'm thankful. Thank you so much.
Definitely,
Thank you.
We'll see you on site as you wish.
Definitely. I would love to speak to, and all the best to all the students. Thank you.
I'd like to thank Dr. Vaishnavi Joshi for sharing her immense knowledge on cancer.
And it was very fruitful and it was very useful to the students. As we are youth, we have got many information about the cancer, and we got many information about the different types of cancer and precautionary measures to be followed. And we learned the food habits which to be followed in our daily life to prevent the cancer.
She told us about many things about how to change our lifestyle at certain moments and what to be done and what not to be done. I would like to thank her for bringing the awareness about vaccines, which many of us didn't know.
I would like to thank the management for arranging the session, and I would like to thank Dr. Vaishnavi Joshi who led me the information about cancer awareness, which would really help me and my loved ones to take the precautionary measures even before we get into cancer.